Welcome to the fourth episode of the Digital Health Voice. Today, we will be speaking with Dr. Conrad Attard, who is the chair of the Board of Studies of the Masters of Science in Digital Health. Wow, Masters of Science in Digital Health. But even more, he's the Deputy Dean of the Faculty of ICT at the University of Malta. And without further ado, I would like to welcome Dr. Attard to the call. Welcome to the Digital Health Voice, Dr. Attard. So, I've had the opportunity to get to know you over the past couple of years, and I know how interested, and not only interested, but also immersed you are in digital health. So, tell us, what's your digital health journey? What brought you here with us today?
First of all, thank you for this opportunity to speak about a bit of the work, research, and projects that we have. We are investing time in related to digital health. Yes, well, if I were to go really backwards, I had initially this ambition to say that the quality of the way people use technology in their everyday lives and the way they are engaging would be so much better if we can see it happen also in digital health. And the reality is that digital health has its own challenges. Health itself, healthcare, thanks to today's technology, thanks to today's people and the investment and knowledge that they are very good at to helping people, not only when they are healing or when they are diagnosed with an illness or chronic illness, but the efforts being done to prevent and to help people in the future. We see that advantage. And I always, in my opinion, say that the digital aspect can only help what is already good, what is already being successful. But with digital health and the digital aspect with health, it motivated me to start this journey. You have to be a bit humble to be fair, that this journey is not about trying to do everything, but actually having a niche, an area, and something that you can contribute with.
That's fantastic, Conrad. I mean, it's at the end of the day, it's all about the journey, right? It's not about, just jumping into digital health and like, what's this? So it's really and truly about a journey, and also about the growing your knowledge within the field, because that is truly, and you said one important word, humbleness. And yes, I agree that in digital health, I think a unique characteristic of the people who succeed, is an element of humbleness as well. But if I may ask, I see that right behind you, there is a very nice banner on PEM. Yes. So I've heard also that you'll be talking about this project in MedTech world. Tell us more about it. Tell us about this adventure, because it didn't start just a year ago. I think a bit more. So it's been for a while. Tell us about it. It's quite cool. What you
PEM is a project which encapsulates different researches with different teams and groups of people that contribute in different aspects. Initially, PEM was a pilot study. It was a research being done at university to see how wearables can help improve the quality of life for people, elderly, particular people with dementia. So that was the first target. To be fair, we did not let go of that goal, this objective. It's because we immediately realized how challenging that area is, but how in need of technology it is. This is something reflected among different groups and researchers around the world. I'm a member of a cross-section which focuses on elderly and how technology and IoT can be adopted within this area of research. But we can see evidently how in need technology is. So it is not just accompanying professionals, but it's a useful tool that can make a difference. It improves quality of life, but makes a difference for the people that are directly affected by the chronic illness that they are diagnosed with. It also helps caregivers. So it helps a lot of professionals, a large investment in this area, that being done by governments that will see an improvement, not only because they are giving a better service, but economically having more funds that can be then invested in a different way, because that's the reality about this area. Elderly, we know the numbers, they are increasing. We see people living longer. There are more challenges accompanied with that, and there is a segment of society that becomes dependent. When we say dependent, not only because of the illness that they might suffer, of the condition, but because it changes their own life, and the family members. So we see this network which affects so many people, more than the numbers that we speak about. So many more people. So then this research evolved. It evolved because we were seeing. And that first thing to do was to understand what research is being conducted, how it is being conducted, and how Malta, University of Malta, can focus on a specific niche which is achievable and build and contribute in this interesting work that is being done. In fact, next month, we're happy to say that a number of people are coming to Malta to experience firsthand, they are researchers, to experience firsthand what work is being conducted in our labs. They are not only there to see it because it's a network. So the idea behind it is collaboration. And Malta, we tend to be the right place to be. Like MedTech is happening in Malta. Why? There's a reason why it's happening in Malta.
I'm really happy about that, in fact. But one thing, it happened in a local healthcare institution. Is that correct? The research,
yes.
Can you tell me where? Just so that our users are really they feel familiar.
So, this is a multidisciplinary research. It's trying to transfer both domains to each other. So we spent hours. We had directly 47 professionals giving inputs regularly on how the system can be designed better. We have already another planned focus group in the coming weeks. So this is something continuous. We never let go of the domain. St. Vincent de Paul, the place where we are collaborating, which is a hospital, residential hospital for the elderly, with a specific areas designed for people with dementia. And remember that our research, although it's focused on dementia, our knowledge can be transferred to other domains. But basically, we keep in touch. We found ways and channels how to collaborate and to listen to the needs. Every step has to be relevant. And because it's an exchange, we know more about the profession, people that are living all the time, years of experience with elderly and want to see a change. They are not, at a state where they're happy or say, this is enough. They want to improve. They always want to investigate more. And this is something beautiful about their profession. They are never satisfied of the situation. They think that things can always get better. We're so lucky to have dedicated people with this mentality. On the other hand, we are giving back IT knowledge. And this combination and mix, digital health, after all, that is what digital health is about, is making our research relevant.
Taijen, thanks Conrad for that. It's so nice to see a research project, especially a digital health and MedTech research project happening in Malta. It's like, for me, it's beyond cool. And I've noticed that you've mentioned a lot. You've mentioned a lot how much importance that you give to research, but beyond PEM, I heard also that you have recently launched, together with the Faculty of Health Sciences, a Masters of Science in Digital Health. How cool is that?
Yes.
I mean, tell me more about that and how research comes into it. Tell us about the new adventure. It started this year, is that correct?
October 2021. It's been being designed for a number of months. The process to propose a new postgrad course, particularly in the time of COVID, because obviously we are, involving a lot of resources, is a challenge. But these months, we had the opportunity, not only within university, even people like you and other people, which are, I call them the influencers of digital health. I don't know the right term, but it's true because they are contributing in such a way to enable this importance and this need to become a reality. Yes, the MSc in Digital Health is a target, an ambitious target, started in October 2021. We had the first group of students that registered. They come from different domains. They are really excited and they are bringing a lot of expertise. An advantage of this course is that we're dealing with professionals which have already invested years to become very good at what they are doing. And now they chose to allocate it and clear a good amount of time. It's a 3 years part-time evening course, which covers so many different topics which we believe are relevant to today's digital health needs. And these topics are being done with them in mind. So healthcare means professions from nurses, occupational therapists, medical doctors, physiotherapists, radiographers, a lot. All these are joining forces together, and they're going to work together to get the digital aspect into their job. They're excited because they react. What is it going to be? Will these technologies be accessible to us? And I would pass on this, if you allow me to, not only to the community of professionals that are going to follow the MSc, but to everybody who is hearing us. You might not be actively into the digital health or not actually actively into IT and health, but there is space and opportunity for you to learn more about this exciting world.
Yeah, I'm really excited, Conrad, that hopefully like conferences like MedTech 𝐿𝐴 and your MSc and many other initiatives that are happening here inspire people to embrace digital health as possibly their life mission. That is really and truly what we would like to do. But, we're here to talk a bit about MedTech 𝐿𝐴 as well. Tell me about it. Will it be your first in-person conference since the COVID-19 pandemic started?
Well, I must admit, as you might know, that I am part of an international organization, and one of the perks of the hard work that we do is we get to travel to speak about our work and to meet people. I miss that a real lot. I'm so happy that MedTech from day one took the challenge to make the event happen. The effort, we can see it all over the social media and all the efforts and the professional people that MedTech managed to attract, making it the venue and the right place to be to speak and discuss more about this importance of subject with the practicality of the subject, because this is something interesting. We are going to see so many experts, so many people that in their own way, as I said, maybe later on, we have our pet project, our focus, are doing something to contribute to digital health. And if we meet together and MedTech creates this opportunity, we can have more collaboration, and we can also dialogue and learn from each other to see, wow, this is a cool idea. This is something we should think about. We should contribute or collaborate. I should learn more about this subject. So I think MedTech, in fact, I must admit, I've already involved even the students and people that we're working with to be there for MedTech this year, face-to-face. So yes, I'm looking forward to the face-to-face part.
Yeah, I also miss this so much. I used to travel so much, especially before COVID started. But hopefully now we'll do some catching up pretty soon, and because we have the necessary tools in hand now to battle this infectious disease. So that's amazing. But with that in mind, thank you, Dr. Attard, for being here with us. And I can't wait to see you at MedTech 𝐿𝐴. Cheers. Thank you for everything. Thank you.